Prevention of lung carcinoma. Majority of the cases they are produced by the tobacco smoking in the form of cigarette, cigar, pipe, etc. But non-smoker also suffer, but in minority. About 80 to 90% cases are the tobacco smoker. Usually the onset of age is after 50 years. After a prolonged insidious period of chain smoking that produces chronic inflammation and irritation that produces mutation in the DNA of the normal cell of the lungs and that produces the cancer cells. But in addition to smoking, there are other factors, risk factors, radon radioactive gas exposure, air pollution, dusty atmosphere, industrial area consists of nickel, asbestos, similar pollution that also irritate the airway and the air bags, air sacs, that is alveoli. So it is a very prolonged procedure, chronic procedure, inflammation or irritation that may cause the cancer cells. The normal cells of the lungs, they are converted after a prolonged irritation and inflammatory process into the cancer cells. And these cancer cells, they are the cells they are very notorious, dangerous, and speedy in replication, aimless speed, aimless division that produces excessive amount of the cells of the various morphology which are of no use to the human body or they produces the danger to the life of the patient. So quit smoking, have a healthy atmosphere. Also, your lifestyle will be very healthy, healthy diet, aerobic exercise at least for 20 to 30 minutes daily regular exercise. Then the diet must be consisting of fresh fruit and veggies, fresh milk, but always avoid the saturated fat. Then there is depression, neurological symptoms, stress conditions. So you have to adopt yoga exercise, you have to adopt good society, study of good literature, hobbies, especially games, so that you can get rid of the tension and stress, which is also a risk factor. Plenty of water, be hydrated, purified water, mineral water is necessary. At least average 15 glasses of water is sufficient for maintaining the hydration of the human body and health. Then you have to adopt palliative treatment. The persons or the patient which are in final stages, incurable stages, they cannot be treated by any method of treatment. But we have to pay attention to those patients to prolong their days of life, period of life, and to reduce the complaint, distress, misery in the patient life by assistance of the home staff, nursing staff, medicals, healthcare providers. So they produces various psychological and neurological exercises, lessons to the patient to keep him happy and to live happy and lessen symptoms with lessen symptoms and trouble, so that he should have a prolonged life with limited distress, trouble, or difficulties. So this is the palliative treatment. Though cancer at this stage, that is in final stage, is not curable by the medicine or other process, but we can adopt various steps to keep these patients happy and symptomless, almost symptomless, to reduce their troubles and distress. So these are the basic factors for prevention of the cancer cells or overall cancer in any organ of the body.